May is Melanoma and Skin Cancer Awareness Month. Studies show firefighters have a higher risk of developing skin cancer compared to other first responders. There's one Bloomfield Hills clinic that is working to offer free screenings tomorrow just for firefighters. Joining us now is Doctors Jessica Kado and Rachel Kado here from the Kado Clinic. Thank you both for being here with us.
Thanks for having us.
So this is an important conversation to have. That is actually news to me. I did not realize that firefighters were especially at risk of developing those sorts of issues. What led to the inspiration to start this event?
So firefighters are part of our community, and this is an opportunity for us to give back to them as well. I think everyone's happy to see a firefighter when they need them. And this is an initiative that was created by the American Academy of Dermatology and the Firefighters Cancer Support Network. And so we decided to reach out to our own community and help screen these young men and women and hopefully divert a crisis or find an early diagnosis with skin cancer.
Yeah, and Rachel, this really just speaks to so much that goes into being an emergency responders and the sacrifices that they have to make for us every day.
That's true. And so this is one way that we can go above and beyond to help out people who are higher at risk. We definitely couldn't have done it without a strong student organization, which Dr. Jessica was working with.
So Students Saving Skin, directed by Callie Mulholland, and the Kado Clinic put together this skin cancer screening. And the most amazing part about this is that skin cancer with firefighters are increased by 20%, specifically melanoma, which is the most deadly form of skin cancer. And so we want to be able to get these people early into the office, get a biopsy if they need to, and make that difference.
And Dr. Jessica, what are the reasons that we see that increased risk for firefighters?
So firefighting is actually a carcinogen, meaning it's described as a cancer-causing agent. And so they think based on the exposure that these people get exposed to, meaning the toxins, formaldehyde, the benzenes, the forever chemicals, they absorb them through their skin, which is the largest organ in your body, and then unfortunately develop these cancers subsequently.
Dr. Rachel, is that something that you need to get ahead of early? I'd imagine that if you wait until it's too late, that makes things harder in terms of treatment.
Well, that's one of the major initiatives, trying to get out there, screening these patients, and being as preventative as possible, which is the best way for us to take care of people in medicine.
So in terms of the event, what do they need to know? Do they need to sign up? Do they need to bring insurance information? How does it work?
So we have a sign up at the station, and we're going to be there tomorrow morning, and then people are going to file through, and with our sponsors we're going to be able to provide some skin screening materials, meaning some educational patient materials, and then also sunscreens and things that will protect patients in the future.
I think it's great that you're having this event because it's also just starting the conversation about how important this is. What is the message that you really want people to walk away from in terms of this event and what you're trying to do?
I think it's probably the philosophy of our clinic. So we started Kado Clinic while we were all each at separate institutions, and what we learned were we were just as frustrated as our patients with fragmented care that was going on, and so we joined forces. And by having rheumatology taking care of autoimmune issues, derm taking care of skin issues, and allergy, immunology taking care of immune issues, we have patients who now can get superior care immediately without having to wait 3 months or 6 months to even try coordinating it. So taking that initiative and going one step beyond, which is finding people who are heroes in our own community and giving them the best care provided by our clinic, is how we want our community to function.
Yeah, Dr. Jessica, you have this shirt here with you?
Yeah, so this is our students. They made this shirt, and they call themselves the Mole Patrol. So
really
we're going to be
cute.
wearing these tomorrow, and hopefully making a difference.
All right, so let's run through it again just so everyone has the details for the event so they know when and where to go.
So we'll be at the firefighter station, Bloomfield Township. We'll be there 8 a.m. and we'll be there as many hours as we need to get through the people that are interested in getting screened.
All right, again, we have Doctors Jessica Kado and Dr. Rachel Kado from the Kado Clinic joining us with this important event. Thank you both for your time. We appreciate it.
Thank you for having us.
We'll also have all the information you need on our website, cbsdetroit.com.